Good afternoon. We are at KORT Fountain today, and I'm Laura Williams. I'm a physical therapist and cancer rehab specialist and clinic director over at Fountain. And then I've got Tori Rasp with us, so she is a physical therapist and cancer rehab and power weight loss trained. So she is at our Versailles location. So we're going to be talking to you today a little bit about our Strength After Breast Cancer program. So this is a part of our Vital cancer rehab program. So we treat a wide variety of patients either before, during, or after their cancer treatments. So we are located throughout Lexington and surrounding, and we have clinicians pretty much at every location that are trained in the cancer rehab program. So we're going to be giving you a little bit more information about the Strength After Breast Cancer program. So that's a program that is specifically designed for our breast cancer patients. It's a slowly progressive exercise program that can help reduce the onset or exacerbations of lymphedema. And we've got Angie Moore here that is going to be asking us some questions.
All right, ladies. What is Strength After Breast Cancer?
So I went into that a little bit, but it's again a specialized program for our patients that do have breast cancer. And it's an individualized, strengthening, progressed program that will help with managing and preventing lymphedema.
Who is the program appropriate for?
So the program's appropriate for anyone that's had breast cancer. So that's men or women or men. So because some people don't realize that men can also be diagnosed with breast cancer.
Why should I do this program?
So there are a lot of benefits with the Strength After Breast Cancer program, and it's one program that has been widely studied, and there's a lot of evidence for it. So it can help you manage if you've been diagnosed with lymphedema. It can help manage it. It's been shown to even reduce the exacerbations up to 50%, which is a really, really awesome number. It can help reduce the risk of getting lymphedema. It can help reduce body weight. It can help improve your quality of life. It can help improve your body image. Strength improvements are definitely a part of it, and it can also actually help improve your bone density. And with other areas, not just breast cancer, but other areas of cancer treatment, we know that exercise has a wide range of benefits, including actually reducing the risk of recurrence. So that's one of the huge benefits of not only this program, but physical therapy during and after cancer treatment in general.
Will this program help me lose weight?
It can. Now we know that exercise alone isn't necessarily sufficient to lose weight, but the exercising components that are incorporated into Strength After Breast Cancer can help to lose weight, especially whenever it's paired with a program that we have in KORT called POWER that Laura mentioned earlier. That stands for Personalized Orthopedic Weight Reduction. So for that, we kind of tailor into patients' treatments that they're already receiving, looking then at diet and nutrition to see how we can best help patients be able to lose weight, which we know sometimes can happen before, during, or after cancer diagnosis.
How many times a week do I come to the clinic?
So this program is pretty unique for a lot of reasons. So it's supervised, but most of the sessions are actually going to be performed independently. So usually around 4 to 6, maybe a few more visits are going to actually be in the clinic. But that's over the course of about 6 to 12 weeks. So most of the sessions are going to be performed at home with minimal equipment or at a gym if you go to a gym, and it's very, very easy to do.
Can I do this program via telerehab or telehealth?
So you can. It is sometimes insurance dependent, and so that's actually on us. So a lot of times we'll take a look and see, we'll reach out to your insurance companies and verify to see if your insurance qualifies for telehealth. But even if not, we do offer self-pay options. But you can do this program over telehealth. The biggest thing is as long as you're not a fall risk though. So if you've had any falls or if you're feeling really unsteady, then a lot of the times we will still suggest patients to try to come into the clinic just so we can make sure that you're safe to be able to do the exercises.
When can I start the program?
So really at any time during the cancer treatment continuum. So there's obviously going to be some precautions after surgery procedures or radiation, but otherwise it can really be started whenever. So a lot of patients will actually be in physical therapy addressing range of motion limitations, some other strength deficits, things like that, and they typically will start it kind of toward the end of that process, but it can really be started at any time, which is another nice benefit of it.
Can I start the Strength After Breast Cancer program while I'm going through chemotherapy or radiation?
You can. So that is assuming though that you're not having any adverse reactions. So for example, with radiation, we know that sometimes you can get skin irritation, edema, a lot of pain. In those instances, then usually that program's put on a pause, or you're working then just in your general physical therapy, making sure that that's not going to risk any further skin breakdown or irritation for the radiation. And then from the chemotherapy perspective, we want to make sure that you don't have any developing neuropathy symptoms, which again, that falls into that fall risk category.
Is this program covered by insurance?
Yes, it is. So that's one of the other nice things. So it's going to be billed just like physical therapy would to your insurance company. So when you call, if you have a commercial insurance, we can see you with or without a physician's referral. Medicare, we typically do need a physician referral, but we can help coordinate that with your doctor. So we make it pretty easy. We call, verify your benefits, so you'll know, about what the cost is going to be. But it's covered by insurance. If you've met your deductible, then it's usually covered. The majority of it's covered. So yes, it is.
If I am having arm pain or stiffness, can I still do the Strength After Breast Cancer program?
Yes, you can. So if you're not already established in PT or occupational therapy, some type of rehabilitative service, on your very first session, your Strength After Breast Cancer therapist will actually do appropriate screenings to look to see, again, are you a good match for right now for the program? Look to see, is your pain and stiffness just from musculoskeletal issues or injuries? Is it actually potentially from the side effects from your breast cancer treatment? And if it's anything that needs to be addressed by a specialized therapist or for skilled services, then they can either do that themselves, again, if they're a PT or a T that's an SABC therapist, or refer you to somebody to be able to get that treatment, then be able to do those two things in actually conjunction a lot of the times.
Will the Strength After Breast Cancer program make my lymphedema worse?
So we kind of addressed that a little bit earlier, but lymphedema is, once it's onset, most of the time it is there. So we typically manage it, and we have connections with lymphedema therapists to help do that. So this program has actually been really well researched. There was a huge trial that went on, and they were actually able to show that it, one, helps to prevent lymphedema from coming on if you've not been diagnosed, and then two, can help prevent or reduce your recurrence of the exacerbations up by 50%. So it's a really helpful tool in conjunction to the other things you're doing, maybe a sleeve, kind of some protection measures, but it's actually been shown to be really safe because, again, it's a slowly progressed overload, so the system is able to handle it so that your lymphedema will be actually better managed doing the program and exercising than not.
Do I need a doctor's order to do this program?
So it can depend on your insurance. So most commercial insurances, you don't require any sort of physician script, but then even if, or if you're already receiving physical therapy, we still all the times will let your doctors know, hey, they're starting this program. But for those insurances that do require a doctor's script, then a lot of times we'll actually go ahead and reach out to them as long as you're comfortable with that, and we'll go ahead and try to get those orders so that way then you don't have to fool with it.
I have a lot of medical appointments and I am very tired from my cancer treatments. How can I fit this program into my schedule?
So one of the things we really specialize with is figuring out how can we best serve the patient where they are. So you may be going through chemo and you're tired, you're exhausted, radiation, you're just fatigued. So it may not be the best time for you to start this. That may be more appropriate, to do maybe some basic physical therapy, to do some stretches, range of motion exercises, and then when you feel like, okay, I'm a little bit less fatigued, I have a little more energy, let's start it then. So as we mentioned earlier, it can be started at any point in that continuum, and even started and stopped and resumed, because we know that life, especially, for treatments, can be variable. It can have its ups and downs. So we'll definitely want to work with you on that. So again, the benefit of it is most of it is performed independently. It's kind of infrequent visits with the PT in the clinic. So you can perform it at home. Sessions take, 30 to 45 minutes. So it can usually be built in. And on those weeks that you maybe don't feel as well, you can kind of pause and resume. And we make it very, very applicable to your schedule, and we'll work with you to figure that out.
I live in Louisville. Is this program available there?
It is, yeah. So we have KORT locations with Revital cancer rehab trained physical therapists that offer our Revital cancer rehab program, as well as the Strength After Breast Cancer program, all throughout Louisville, all throughout Lexington, even in some of our other regions, so south near Bowling Green, Bardstown, west, Owensboro, Madisonville, those areas. So we pretty much have areas, all of the kind of central western part of the state. So we're happy to help get you connected there.
And then again, if you're in a location that maybe isn't immediately near your clinic, or if it just seems like it's kind of difficult to be able to get into a clinic, again, that telehealth option sometimes can be a really good choice, assuming that you're appropriate for telehealth and not necessarily we're not worried about falls or anything.
Yeah, so like she was saying, we've got 3 convenient care options. So we've got the in the clinic option. We've got the tele-rehab option, and then we've also got in-home PT option. So in any of our areas where we have KORT locations, we also offer in-home PT. So if you're, maybe not up to coming to the clinic yet, that's a perfect situation. Or if you're immunocompromised, the tele-rehab or the in-home is a great option. So please feel free to connect with us at KORT.com. That's KORT.com. We've got an easy, quick live chat there that they can help get you connected, and we would love to help you out if you need our services.